I'm Antonio De Carlo, and I am the Chief of Abdominal Organ Transplantation and Surgical Director of Transplantation at Temple University Hospital. I started off in Montreal, where I did my undergraduate, med school, residency, research fellowship, all at McGill University in Montreal. Then I migrated to Madison, Wisconsin, where I did my abdominal organ transplantation training. Madison is one of the legendary transplant programs in the country. They are credited with creating the organ preservation solution and have one of the largest transplant experiences in the world. The transplant field, we take patients that are too sick to be cared for, patients that would at times not survive an operation, patients that cannot be given standard care, or other services, other surgeons, other hospitals are not capable of taking care of them. And we take these patients at their lowest point. We do phenomenal operations, the complexities that are incredible, and we turn their lives around. We take them from a low point to giving them a new birth, and that is phenomenally rewarding. I deal with organs of the abdomen, so primarily liver, pancreas, and kidney. We have a score where we calculate what is your likelihood of being alive at 3 months, and that is who we give organs to. So these are patients who have no quantity of life and do not even understand what quality of life is anymore. They're dying, and they're hoping that something happens to turn this death around. We take these patients that are too sick to be operated on for other things and give them their freedoms back. We take people and return them to being productive members of society. In transplant, we rely on the generosity of society. So the other phenomenal miracle about what I do is that you take people who are facing intense grief and low points in their lives. They just lost a loved one. They lost a father, a brother, a child. And now we ask them to put aside their grief and their mourning for a few seconds and think about how they could help other people. It is amazing what Temple has done in the last few years under new leadership. There's a new dynamic to Temple. There's a new vibe. Temple has attracted and accumulated a phenomenal diversity of expertise and leaderships in the field from all over the country that are now here together making miracles happen. This is a phenomenal time to be at Temple. Right now at Temple, in the kidney program, we have one of the highest rates of organ transplantation. That is because we have a team that is able and committed to looking at every organ that becomes available and see if there is potential in it. We have nephrologists that are ready at 2, 3 in the morning to come look at slides with us. We have pathologists that are ready at 2, 3 in the morning to come look at slides with us to see the biopsies of some of these organs. And we can sit down and have team meetings in the middle of the night and run down our list and see who this would work for. It is a phenomenal team that is gathered, and in my years of working, I've never seen a team as passionate as this or as committed to doing it.